Dr. Hall. So lecture 16 is teratogens and pregnancy. And so for 16A, we're going to start by introducing teratogens using the historical example of thalidomide. So first of all, a brief review of what we've talked about so far. So fertilization, sperm meets egg, use its acrosomal cap to burrow through the zona pellucida. Its nucleus fuses with that of the oocyte. We have a zygote, which then undergoes cleavage or rapid mitosis to make multiple exact copies of itself. Eventually becomes a ball of cell and then a blastocyst, which then implants in the endometrial lining. The placenta is then established by the trophoblast, and the inner cell mass becomes the embryo, which will become a three-layered disc that then curves around itself. And then all of the outlines, the beginnings of the major organs are formed during embryogenesis, or the first 8 weeks after fertilization. Then we enter the fetal period, where we see further development, maturation, and growth of the fetus. We then also talked about when things go wrong. So we talked about ectopic pregnancy, where the blastocyst accidentally implants most commonly in the fallopian tubes, which is a life-threatening emergency for the mother, and unfortunately the fetus cannot be saved. And then we also talked about miscarriage, which is also technically called spontaneous abortion, the vast majority of which are due to an underlying genetic defect that was not compatible with life. We then talked about congenital abnormalities, and the example we used for chromosomal ones was trisomy 21, Down syndrome. So you'll recall that's when there was an error during meiosis and formation of the oocyte, so you had a third copy of the 21st chromosome. And that's more common in women who are older. And then we talked a lot about screening tests for Down syndrome, diagnostic tests for Down syndrome, and the pros and cons of screening. We then talked about mechanical causes of abnormalities using the example of amniotic band syndrome, where the fetus can get its most commonly limbs kind of wrapped around and tangled in these fibrous bands of tissue that can then cut off circulation to that developing area of the body. And then now today we're going to talk about teratogens. And so a teratogen is a drug or an infection or some other type of substance that doesn't significantly harm the pregnant person but can cause significant problems for the embryo or fetus. So, teratogens. This is an advertisement from the British Medical Journal in 1961. I think you can see that up there. So this is a journal for doctors, and this is an advertisement saying this child's life may depend on the safety of Distaval. Now, so at the time, there were a lot of housewives who took sedatives, things like Valium and barbiturates, to treat nerves or anxiety. And the problem with that, there were many problems with that, but one was that these were medications that if a child took them, could kill them because they suppress your drive to breathe. And so in a child, right, that would be a big overdose for them to get the same type of dose that an adult might take. And it may seem strange to you, but back then there were no such thing as child-proof caps on prescription bottles. Those hadn't been invented yet. And so there was actually a problem with children dying from unintentional overdoses of their mother's anxiety or sleeping pills. So this ad touted a new medication that was used to treat insomnia, right? And the cool thing about this was that this medication would not be fatal in overdose, right? So you don't have to worry about these accidental poisonings of children. So they were saying this is going to be a great new option. And so people were really excited to have a medicine that wouldn't be dangerous to children. So Distaval was the brand name, and the generic name, the name that is infamous nowadays, is thalidomide, which you maybe have not heard about before, but people of my generation certainly have. So There is a YouTube video about Dr. Frances Kelsey that I'm assigning to you as a media assignment. Usually we watch it during class. She's one of my heroes, and the video is narrated by Andrea Tone, who's a medical historian on whom I have a huge fangirl crush. So thalidomide was approved in Europe, right? This is the British Medical Journal. It was approved in Europe and sales just really skyrocketed. This seemed like the answer to a lot of problems. In the United States, however, Dr. Frances Kelsey was really unusual because she was a scientist at a time when most women didn't even go to college. She held up the FDA approval of thalidomide in the United States. Against great opposition, she repeatedly said, no, there is insufficient data on the safety of this medication. I will not approve it for use in the United States. And so you can see here's a picture of her receiving a Medal of Honor from John F. Kennedy, president at the time. So now you're starting to think, well, maybe she was right that there wasn't evidence that this was safe. So thalidomide did cause a lot of problems in fetuses who were exposed to it when their moms were pregnant. And so you need to understand that in the 1950s, thalidomide was not only used as a sleeping pill, it also got used to treat morning sickness in women. It was a really good anti-nausea medicine. Morning sickness is most common at the beginning of your pregnancy in the first trimester, first couple of months, right? At that time, doctors believed that drugs could not cross the placental membrane, that the placenta was a defender of the embryo and fetus against any potentially toxic substances that the mother might ingest, right? But Dr. Kelsey said, no, I don't think this is safe yet. And of course, she was right. So thalidomide ended up causing limb defects. So babies were born that had severely malformed or entirely missing extremities. So here's a young girl who has no arms, and so she has learned to do everything for herself with her feet, right? So there she is eating her breakfast. And here are some children, right, who all have these defects, right? The upper limbs are mostly just these kind of little flippers, right? These little paddles, but their lower extremities in these children are fine. This baby here, the lower extremities are also impacted. So thalidomide caused these really severe defects in the limbs, like the arms and the legs. The challenging thing was that when these babies started to be born, it took actually quite a long time for people to realize that the thalidomide was the problem. Initially, they thought it might be due to some radiation fallout from some nuclear weapons testing that had been happening in one of the regions where this first started to occur. And so it actually took them quite a while to figure out that thalidomide taken by the woman early in the pregnancy was the problem. So once they figured that out, they withdrew thalidomide from the market, and obviously pregnant women were not taking it anymore. Interesting, a little side note, thalidomide has now been reintroduced for the treatment of leprosy and certain cancers for which it is effective, but it's very highly regulated because we know it's a really potent teratogen. So this is another video about a woman who was born with limb defects due to thalidomide, another one of your media assignments. So this is the first example of a prescription drug teratogen, right? So thalidomide was a chemical that didn't adversely affect the mother, but causes harm to the developing fetus. And so then we have to think about, okay, well, what are the factors that will determine how teratogenic, how much harm to a fetus something might do, whether it be a drug or some other substance? So the four main questions that we're going to consider in trying to determine if something is dangerous for a mother to take is, first of all, can it cross the placenta? So there are some chemical molecules that are too big or too charged to actually move across the placental membrane. They will stay in the mother's bloodstream entirely. But there are other things that can quite easily cross the placental membrane and get into the fetal blood circulation, travel through the umbilical cord into the fetus. So that's the first question. If it can't cross the placenta, then we don't need to worry about it. But if it can cross the placenta, then we need to think about that specific drug's characteristics. Ooh, I spelled that wrong. It should be do, right? What can that particular drug do? And how much is taken? So in toxicology, they often say the dose makes the poison, right? You know this. If you have half a glass of wine, that's very different from having 5 glasses of wine, right? So the quantity at which the substance is taken is also important. And then unique to teratology, which is the study of teratogens, is at what stage in the pregnancy does the exposure occur? So this is often called, the developmental stage. So what parts of the fetus are developing when, oh, my cursor isn't working correctly. All right, never mind. I can't underline things anymore, right? What parts of the fetus are developing at the time that you take this medication? So this, oh good, I got it back. So this chart shows us the different developmental stages. So in the first couple of weeks, weeks 1 and 2, that's when we have fertilization, we have the zygote, we form a ball of cells, it becomes a blastocyst, the blastocyst implants, and then eventually we form that 3-layered disc. So during these first 2 weeks, either the teratogen is severe enough that it's going to end the pregnancy, and remember, the person probably doesn't even realize that they're pregnant yet, or the embryo ends up being just fine. So in the first 2 weeks, we really see an all or nothing phenomenon. Because remember, for most of this phase of the first couple of weeks, the cells are totipotent. So if some of the cells get killed off or damaged, it's no problem because other cells can just fill in for them. But if all of the cells get killed or damaged, well then of course, then that's the end of the pregnancy. Then when we look at the embryonic period here, we can see we have lots of development of the central nervous system and the heart, right? And then here we start with the limb buds, right? And what's interesting is that around 5 weeks is when morning sickness starts to become pretty pronounced for a lot of people. So this is when people would start taking thalidomide to treat that nausea, to treat that morning sickness. So if you're developing your arm buds and thalidomide is a medicine that's for some reason, it tends to interfere with the production and creation of the arm buds, then taking it at this phase in the pregnancy is going to cause those limb defects. Once you get to the end of the embryonic period and you enter the fetal period, remember this is our organogenesis, right? Organogenesis. I'm not very good at that, right? So all the major building blocks for the organs are laid in during the embryonic period. So if you get exposed to something in the fetal period, the effects are going to be less severe, right? Because everything is already, all the big decisions have already been made. We're mostly just putting the finishing touches on things in the fetal period and growing and maturing them. So very early exposure in the first 2 weeks is usually an all or nothing, okay? So either all the cells of the developing embryo are killed or some are remaining, but they're still totipotent, so they can fill in for which other cells may have been lost, right? So either it entirely ends the pregnancy or things are just fine. So sometimes I get, people are worried, they just found out they were pregnant because they just missed their period, so they're maybe, 2 weeks out from fertilization, and they're like, oh no, and last weekend I had 3, glasses of wine. Well, it's going to be an all or nothing thing, right? So either the embryo is going to be totally fine, or the pregnancy isn't going to continue and they'll have a spontaneous abortion or a miscarriage. So if the exposure, this is reviewed, during the embryonic period, we're going to expect severe defects or maybe they're even going to be so severe that there's going to be a miscarriage, because this is really important stuff, building the basic structures for the embryo here. And during the fetal period, right, because the basic structures of the major organs are already established, we're usually going to see minor defects, problems in function, or just overall poor growth. So it's going to be less devastating, but not that it can't still cause significant problems. So this is a summary chart of the same thing. Again, in the first 2 weeks, it's going to be an all or nothing phenomenon. Embryonic period exposure to teratogens, you're going to have severe defects or miscarriage. And then fetal development, you're going to have less severe defects or problems with function or growth. So thalidomide, because it was taken early in the pregnancy when the limb buds were forming and first developing, right, caused major structural defects. And that's it for 16A.